We are going to end with 4. Number 4, it says, be able to handle information in agreed ways. Information is very essential in any setting. Now, 4.1, 4.2, 4.3, and 4.4, we're going to discuss this together and as holistic approach. 4.1 says, understand why it's important to have secure systems for record keeping and storing information. Remember, it's very important to keep information confidentially. And this actually is an act that must be followed. Legally speaking, you are not allowed to expose the service user's information to anybody outside your work environment and those agencies which you are working with. So this nails 4.1 because of Data Protection Act. In your workplace, there must be somewhere where certain information actually is locked with a key proper, and only certain people have access to those keys because service user information is confidential. Be aware of how to keep records that are up to date, complete, accurate, and legible. How do you keep this? In every work environment, there is a format that you agreed with your employers and the service users. So follow that format. And once you follow that format and you update information on a regular basis as agreed, if they say update every week on a Friday or daily after work, do that. There are certain things that can be reassessed, the needs of a service user. Some employers do this every 6 months, or when they perceive a change. Or every 2 months they do a reassessment just in case things are changing rapidly. So now, the records you keep must be dated, signed by 2. Whoever is in charge of keeping records and validating, and the line manager. You sign when you finish work, if that's what's agreed. You sign off, today I've done this A, B, C, D, and I have not seen any changes in Mr. or Mrs. service user. You sign. The other person who comes, they can see your signature and the date and what you wrote. Now, there are those things that have to be changed. Only those people who are authorized, like your line manager and the directors, can do that. This is very important because the Data Protection Act 1998 regarding handling of information does actually say information must not be shared with anyone who is not authorized. Their level of authorization and escalation. So it's very important. And when you keep the information up to date and accurate, it's also good for the service user because they will receive, again I said, quality care and appropriate care. Because if things have changed, for example, on medication, the GP has recommended a higher dose or a lower dose, you must know that it's been done and signed, and then you follow the right procedure. Be aware of, that's 4.3. Now be aware of agreed procedures for record keeping. What is a procedure in that workplace you follow for record keeping? From the care plan to other documents and in the office. Follow the procedures. Through training, we cannot tell you that this is one method and that's the only method. No, we can't do that. But what we tell you is that follow agreed procedures. When you're being given a job or when you're given a job, at their own induction, administrative induction, they'll tell you how they keep records and stick to that. How they keep or record information, stick to that. How they store information, stick to that. It could be that, number one, they have a login system with your own password, you record information, only you have the password. Their own administrator who looks after the whole system has access to all the pieces of data for all staff. That could be one method, or it could be by hand and you log in a cabinet. Or it could be in a certain forms that you record, you leave them on the table, then somebody else picks them up and logs them up. Whatever method They tell you that's what they follow. If it's legally approved, follow that. I don't think there's any employer who would ask you to record information publicly and leave it by the doorsteps. No, they can't do that. If you find anybody doing that, I think it's also your responsibility to escalate and make sure that it's corrected. Sharing information. What procedures exist in the workplace to share information? How do they share information? Is it through meetings? Is it through just the care plan? How do they do this? Find out the procedures. There must be standard procedures the employers have agreed. Sometimes they can give you a manual, a working manual, which they update every 6 months or every year, and maybe it could be electronic system like I mentioned before. So all these methods must be counter-checked to your agreement and the system they have set up already. What are these standards? It's also good to ask questions. Sometimes when you go for interviews, because the care industry can be so fast that even the employers themselves may not be aware that certain things have changed. But that would be an unfortunate situation. But if you are aware that certain things have changed, or they were announced yesterday, and you just go for interviews a day later, and there's no mention of that, you can ask questions. Because a proper interview, they should be able to say any questions. If they don't say, you can ask the question. Because, you talked about this code of conduct. Are you aware that yesterday they announced the new ones? Things like that. Be aware of how and to whom to report if you become aware that agreed procedures have not been allowed or followed, sorry. Whom do you report to? If, for example, you're working in a team, or even your manager, the manager themselves, or the case may be, who do you report to? Are you going to be a whistleblower? Or are you going to be somebody who is going to help the system to correct itself? The choice remains in your hands as you become aware of what should be done. Sometimes it's not good to be malicious. Be somebody who is an agent of development, an agent of improvement. Unless systems are not being changed, the case is different. So you should be aware. Normally there's a line of authority. There is you, there's your supervisor, there's a general line manager, then there's a overall a director, and then from beyond the director is external agencies. In the UK we have the CQC. Then you can escalate to those bodies, or it could be an area of safeguarding that needs to be brought in for training. There are materials that you can access from regulatory bodies. So it is really part of your role to research and have the right information. When you come on a training like this one, this is what we provoke in you, to become aware of how the system works. It becomes part of your duty of care as well. Your employer, some employers, in fact, most of them, they do send their staff out for training before they proceed for interviews in the next phase. They have phased interviews. They like your face, like your skills, then they say, okay, the last part, go and pass the common induction standards. Once you come through this program successfully, they take you on. But then when you go back to see them, you are a different person because you have now known more information than before. So you can be part of the improvement agency within your workplace. So it's very important. In summary, we have looked at different aspects of the role of the health and social care worker. And this is an overview. And I'd like you, as you leave this training, to go and do more research on this. Do it religiously, research deeply, so that you can know the finer details. There are books that you can also read in the health and social care, I think the health and social care work level 2 QCF diplomas. They are available by certain providers. You can read those materials. In summary, I've looked at the responsibilities of the responsibilities and limits of your relationship with an individual. We have looked at you to demonstrate your main responsibilities to an individual you support. Be aware of ways in which your relationship with an individual must be different from other relationships. We say it's going to be professional. And in number 2, we said working in ways that are agreed with your employer. Be aware of the aims and objectives and values of the services in which you work, as 2.1. And 2.2, understand why it's important to work in ways that are agreed with your employer. And 2.3, we said know how to access full and up-to-date details of agreed ways of working relevant to your role. Your line manager is that who are your employers. In fact, they give you the employer's handbook. Everything will be in there. And you find that policies in that handbook they give you will be recorded and will be very clear. Unless you don't understand them, you may ask. And also we looked at number 3, which is the importance of working in partnership with others, which are 3.1, understand why it's important to work in partnership with carers, that is your colleagues, families, advocates, which it could be lawyers or anybody who speaks on behalf of the service user, and others who are significant to the individual. We talked about the district nurses, GPs, or the police, or the councils, etc. Also recognize, as 3.2, recognize why it's important to work in teams and in partnership with others. So you know what others have done, you may not repeat the same things they've done, or you just pick up the pieces where they've left off, communicated through the care plan and more. And 3.3, be aware of attitudes and ways of working that help improve partnership with others. The attitudes, especially record keeping, identifying areas of improvement through training, etc. Be able to, that's number 4, to handle information in agreed ways. And we said 4.1, understand why it's important to have secure systems for recording and storing information. Data Protection Act 1998. All information must be kept confidentially. Do not allow other people who are not supposed to see certain information about the service users to access it. Only within the realm of your workplace, and those people who are supposed to access it, like your colleagues that you work together with. Be aware of how to keep records that are up to date, complete, accurate, and legible. Legible, that's a point probably we didn't talk about. When you're writing with your hand, write clearly. Some handwriting is scribble, you can't read. It's important. By and large, look at the recording systems which the employers have provided for you to use, or to you to use. Number 4.3, be aware of agreed procedures for recording information, storing information, sharing information. They must provide you with the procedures they have agreed in the workplace. And the contract that you sign actually must include these things, so that when you begin to work, you must follow the accurate procedures. Now, sometimes these recording systems can be manual or electronic. Electronic with a password. Manual is ordinary books, but they are kept securely somewhere. Number 4.4, which is be aware of how and to whom to report if you become aware that agreed procedures have not been followed. Your line manager. Your line manager, there's a director. Beyond that, there's external bodies. So in your region, in your environment, see who are the external bodies and pertaining to what areas of a discussion or importance you're looking at. This is important. I'm so delighted that you have followed through this instructive program on the audio and also CD. This is an overview. It is a pointer to the training that you are going through. But for you to learn more, I want you to do a research in every area of what we discussed. And as we said, we're going to be dovetailing these programs into the role of this health and social care worker, effective communication, and personal development. To research further, that is personal development. To make sure that you communicate very well, as we discussed, it's called effective communication. And it points into the role of the health and social care worker. Thank you very much. Signing off from Standard 1, it is your trainer, Dr. John Nukomona.